Place the kit at room temperature 30 minutes before use. Prepare a sterile surgical field in order to manipulate the components of the 3 trays of the kit once opened. Unwrap the Petri dish and place it on the heat pack. Inject the contents of the pre-filled syringe 1 digesting buffer into the bottle of powder containing the digesting cocktail. Homogenize the solution and using the syringe, transfer the solution into one of the 2 compartments of the Petri dish. Close the Petri dish. Activate the instant heat pack by pressing on the metal plate . Then place the closed Petri dish on the heat pack. Perform a local anesthesia on the donor site before the procedure. Using a dermatome, collect a thin skin graft of 0.2 to 0.3 mm thick. Once the thin skin graft has been collected, maintain it in physiological serum during the kit's preparation. Transfer the thin skin graft in the compartment containing the digesting cocktail and maintain the Petri dish on the heat pack. Close the Petri dish and allow it to warm for 15 to 20 minutes. Without a transfer needle, deposit the contents of the pre-filled syringe 2 washing buffer into the second compartment of the Petri dish. Using sterile forceps, rinse the skin graft into the second compartment, then place it inside the Petri dish cover. Using sterile forceps, separate the epidermal part from the dermal part in this manner. Without the transfer needle, deposit the preparation medium from the pre-filled syringe 3 collecting buffer onto the skin fragments drop by drop. Using a sterile scalpel, repeatedly scrape the cells from the junction surface and cut the epidermal part into small fragments in order to recover the maximum amount of cells. Screw the transfer needle onto the empty syringe 3 and retrieve all the cell suspension by tilting the Petri dish cover slightly. Deposit the cell suspension in the empty upright container provided in the kit. Replace the stopper on the container and leave at room temperature during the preparation time of the site that needs to be treated. Perform a local anesthesia on the site that needs to be treated before the procedure. Using a laser, carry out a superficial dermabrasion in order to reach the papillary dermis. After the dermabrasion, the skin aspect will show a small bleeding characterized as pinpoint bleeding. Install the transfer needle on the pre-filled syringe 4 hyaluronic acid and inject it into the container containing the cell suspension. Homogenize the cell suspension and collect it using the syringe. Apply the cell suspension immediately drop by drop onto the previously dermabrased area that needs to be treated. Apply a silicone dressing above the treated area in order to maintain the cell suspension and allow maximum cell-to-skin contact.